Today we will be demonstrating vital signs.
Hey there, my name's Amy. I'm going to be your nurse today. Can I have your name and date of birth?
Courtney Jones, 1/1/2000.
Thank you. I'm going to make sure that I've washed my hands, I've provided privacy. So today the doctor has ordered some vital signs. So we're going to do those now, if that would be okay with you. We're going to do 6 different vital signs. First, we're going to start with temperature. So for temperature, there are multiple options in the lab. This one is the forehead or skin thermometer. There may be different names for that. This one you would want to hold 1 to 2 inches from their forehead, push the button, and then breathe the number. Some of these thermometers you have to actually touch to the actual skin. So if you use these in your setting, just make sure that you know which type you have. This one is your tympanic thermometer. So this one is the one that goes in your ears. So for an adult, you would want to go up and back with their pinna, but for a child under the age of 3, you would want to go down and back. And always make sure you're using a cover for this. We don't want everybody's earwax over top of this. Then there is the oral thermometer. So the oral thermometer is blue. So this one you would put on a probe cover, put it under our patient's tongue. You can also use the same one for the axilla or for the armpit for an axillary temperature. Again, put the probe on and go underneath of their armpit into the axilla. And for that, you want to make sure there's not excessive sweat or any lesions because that could alter our reading. There's another one that looks just like this but is red, and that is a rectal thermometer. So please do not use the rectal thermometer in somebody's mouth. But for this sake, we are going to use the oral thermometer version, and I'm going to put this probe cover on. You can adjust it to if it's oral or if it's axillary on here. Then I'm going to have your patient open their mouth, right under their tongue, they can close their mouth, and then we're just going to wait for a reading. 98.3, so that is normal. So I'm always going to make sure I record her vitals. So 98.3 degrees Fahrenheit. And for that, our normal for temperature is 95.9 to 99.5. So that is a normal reading. Next, we're going to move on to her radial pulse. And for this, you're going to need your instructor with you. So you can be feeling one radial artery while your instructor feels the other. So for this, we can do it for a full minute, or we can do it for 30 seconds and multiply by 2. As long as it's regular, I'm just going to do the 30 seconds and multiply by 2. And it looks like my instructor brought my timer for me, so.
But they won't always.
But they won't always. So once I feel it, I'm going to push start. All right, and then we'll stop. So I got 49. So 49
50.
times 2 is 98. So as long as we're within 2 to 4, we will count it. So it all depends on when I stop looking at the clock, and she did as well. So with a pulse, we want to make sure it is either weak or strong. So I would say her pulse was strong, and you want to say the regularity, and I would say it was regular. So you want to also know if it was regular or irregular. And your rate is always just the number that you calculated. So next, I better put 98 down, 98 beats per minute, because we don't want to forget it for our charting. So now we're going to do the apical pulse, and for this one, we're going to use the dual stethoscope, just like you will for your checkoff. So you want to locate the PMI, or the point of maximal impulse. So for this, it's your 5th intercostal midclavicular. So if she had a gown on, it would be much easier to count, or if I could go under her shirt. But for the purposes of this video, we will not. So I would count 1, 2, 3, 4, 5. Go midclavicular. Usually it's approximately at the bra line of a female patient. So you always want to make sure you got your stethoscope inappropriately, we're going to use the diaphragm. And for this, we're always going to count for 60 seconds for your apical pulse because there are some medications that you need to record the apical pulse before you administer the medication. All right, and I'm going to push start. Ready, go. All right, and we are done. So with that, I also got 98 beats per minute. So you also want to note the S1, S2 if it's normal. So that lub-dub is what we want to hear. There are many other kinds of heart sounds, but if it's abnormal, you would just state it's abnormal, and there was not a clear S1, S2. But Courtney here had a clear S1, S2. It was regular, and it was strong. So now we are going to go into her blood pressure. So first, do you know what your normal blood pressure reading is?
About 110/70.
Okay. So you want to ask them that, and then you want to pump up your sphygmomanometer past 30 millimeters of mercury past her top number. So she said 110. So I would say I'm going to pump it up to 140, but she might be a little nervous since we're doing this checkoff. So I would probably say to pump it up to 160 to just give us a little extra room in case her nerves kick in. So I'm going to first have her put her arm up here, feel for her brachial artery. Once you feel it, that is where you're going to be putting your stethoscope, the diaphragm of your stethoscope. You're going to take the cuff. You want it to be approximately 40% of her arm to know that it's appropriate. While we're talking about cuffs, this is a regular cuff. If a cuff is too big, it will read low, and if a cuff is too small, it will read high. So that's why you always want to make sure you have the appropriate size cuff. So I'm going to wrap it around her arm. Make sure we're focusing on that artery line right where I felt it. Then make sure I have my tubes in order. Put the sphygmometer meter where both you and the instructor can see it. Are you able to see it there?
Mm-hmm.
You want to make sure you don't have this too tight, the valve, because otherwise when it comes to do it, I'm not going to be able to release it, and Courtney will not like it when her arm is being squeezed really tight. So you want to turn it to the right. So once you pump it up to, I'm going to say 160 for her, that you pull it back just a little bit, and the needle should have a gentle glide down. If it goes down really fast, you need to redo it because you're not going to be able to hear all those numbers. And if you do need to repeat a blood pressure, you should wait approximately 2 minutes because if you do it over and over, you can alter their blood pressure reading. Okay, so get these ready. So when I do this, I'm listening for the quarter cough sound. The top number is your diastolic, and that's your first quarter cough sound. And your last quarter cough sound is your diastolic. So I got 104/68.
Got about 106/70.
Perfect. 104/68. All right, so we are done with her blood pressure. Now we're going to do her pulse ox. So with this, you will need your pulse oximeter. There's ones that look like this, and there's the home version. Either way, you want to need to make sure you turn it on before you begin. You're going to see if their hands are really cold. You can check her pulse or cap refill, and if it's less than 3 seconds, you know it's appropriate to use that finger. So if that's okay, I'm going to use that finger. She has no nail polish on because that could cause an error in her reading. You just want to hold her arm or her finger steady. And you're looking at the waveform, which are just little dots, to make sure it goes up and down appropriately. So her pulse ox reading, so her oxygen is 98%. So I'm going to make sure I record that. And that is normal. And normal oxygen saturation is greater than 95%. And there's also a pulse on there, but we already read that, so we don't need that. Lastly, we are going to do her respirations. For this one, I like to do her pulse for 30 seconds and then do her respirations for 30 seconds so that she doesn't know what I'm doing. But for the purpose of this, I'm just going to hold her arm and fake it, but I'm really counting her respirations. And again, you would say start and stop so your instructor knows when we're doing it. And go. All right, so I got 7. So 7 times 2 is 14. And I dropped my pen, so I'm going to pick that back up and write 14 for her respirations. So this concludes our vital signs. You would want to make sure that you've documented all these in the computer. Wash your hands when you leave, and ask your patient if they have any other concerns or questions. And if not, you are done with your vital signs.